I want to talk about the United Nations Convention on the Rights of Persons with Disabilities, and that covers people with psychosocial disabilities. So I will use that term rather than term mental health consumers. One of the really important aspects of that convention is that people with disabilities, and in this case people with psychosocial disabilities, are absolutely fundamental and need to be consulted on all aspects of whatever happens to them, and including organisations of people with disabilities. So my question is, when will we expect to see the funding of a national organisation of people with psychosocial disabilities? I know that this is something that the government has actually done a lot of consultations around. There is a proposal up there to actually fund an organisation, and yet we haven't seen any progress yet on the funding of that organisation.
There was a peak body for mental health consumers, if I can use that term, because that's the term the organisation used, that was liquidated in 2008. And following that, there was a scoping study that we commissioned for a replacement consumer organisation. In the meantime, I guess their advocacy moved into the Mental Health Consumer and Carer Forum that's auspiced by the Mental Health Council. I actually met with them for breakfast this morning. But what we do have before us is a scoping study about what we might do to create a more independent, standalone mental health consumers advocacy organisation. I've said to consumer advocates, including those represented on the expert working group, that I'm building our response to that into the general discussions around, first of all, investments in some of those cohorts I've talked about, but more broadly, a lot of the work that came from my consultations and the work the expert working group has done is around accountability, transparency and advocacy in the system. So we'll have something to say about that over the next little while, but I wanted to build that into the broader response we make in mental health. The follow-up was you can't have the broader response without the voice for consumers, and I've heard that message quite clearly.
Bruce Shaw from Aged Care Association Australia. You referred to the Productivity Commission draft report on aged care, caring for older Australians. There's also been one released a few weeks earlier than that on disability.
Later.
Sorry, a couple of weeks later. The government is expecting the final reports from the Productivity Commission sort of in the middle of this year on both. However, there's a budget in between time, and they both are very detailed reports which have major workforce ramifications that will take sort of a long time to flow through. Is there any scope for at least some initial funding for some activities or the establishment of some of the recommended bodies in this year's budget?
Well, I can't talk for disabilities. That's not my portfolio. But in aged care, you're right. The final report is due in June. The budget is May 11, and as people who've been around budget processes understand, it's not May 11 when we suddenly wake up and in the morning write the budget. I mean, these things are very far progressed already. So I think it's fair to say that we're not going to put things in the budget that preempt the structural reforms that the PC has recommended. We think that a commitment was made by the government and by the PC that the community and the sector would have an opportunity to absorb what is a very significant report and provide a response to it by way of written submission and the public hearings that are going on now. So no, that doesn't work. But what I've also said is that the Earth has not stopped rotating on its axis because the Productivity Commission is undertaking an inquiry into aged care. As I've said, we're in the process of rolling out a number of very significant workforce programs, and there's a number of other discussions that I have on a weekly basis, frankly, with the sector about how we can deal with some of the challenges that are upon us now. It's not an easy balance to get, but I think that it is important that the sector has understood that this is an opportunity that comes along once in every 20 or 25 years to have a discussion about the roots and the branches of the aged care system, and I think we need to do it in an orderly, well-sequenced way.
Minister, Mike Stewart from Mental Health Carers are after me. How are you?
Hi, mate.
Is the government looking at changing the way that they deal with the system in that regard?
Well, I can't talk generally about the SACS area, the Social and Community Services area, which is really what you're describing. I know, and I think we all understand in this place, that the reason for the wages gap, for example, with state public sector organisations, is that we all started at the same base in the early 1990s after a ward restructuring, and then what's happened is that the Commonwealth has had various indexation arrangements for Commonwealth funded services, and the state governments have run enterprise bargaining rounds which essentially have delivered 3.5% to 4.5% per year for the best part of 2 decades now, or certainly for the last 15 years. And that's where the gap comes from. So we know this is an issue we have to grapple with if for no other reason that the ASU and a number of other unions have initiated the pay equity case in the SACS area. In aged care, the aged care organisation's complaint around indexation is the COPO system, which I think is now called the COPE system, the Commonwealth Own Purposes Outlay system that was introduced in the mid-90s that effectively combines CPA and wage movements, but has delivered for most of the last 15 years around 2% per annum for aged care providers. Now, 70% of an aged care provider's costs are labour costs, and the rest are generally food and utility type costs, which are generally running at or ahead of inflation. So this is a significant burden on aged care providers. I understand that, and one of the significant recommendations in the Productivity Commission draft report is for a different type of indexation, or a different process at least, for indexation in aged care. I can't tell you what that means we'll do into the future for the reasons I just outlined to Bruce, but I certainly can't say what the response of the government to the SACS issue is going to be, but I think we understand that indexation arrangements are part of the reason why we have this pay and recruitment and retention issue in so many of these sectors. These are really hard asks because every bit of indexation, additional indexation to an existing program is something off our ability to do a new program or provide a new provider with the opportunity. So these are hard things that are not going to be fixed overnight, but we recognise go to the core of the sustainability of this sector.
Hi Mark, Yasmin Noon from Australian Ageing Gender. Obviously a lot of aged care providers have pinned their hopes on the Productivity Commission's report, but they've also expressed their opinion that they're quite nervous that nothing will actually be done because previous reports and inquiries have just sat on the government shelf. Will you do things differently? Do they have, I mean, because I know you've mentioned that a discussion will take place after, that you are committed to reform, but people are still quite nervous that they are pinning their hopes on something that won't eventuate.
Well, my commitment to reform is not that important. The PM has indicated a commitment to reform. You can put that in the bank more than you can mine in terms of something that's actually going to yield results. She has indicated she's committed to reform, and as I've said, there are a number of senior ministers in this place who have a deep understanding of this sector, either because they were shadow ministers or because, like Wayne, they've just taken an interest, as people from Queensland would understand. Look, there is a room somewhere with the heads of various aged care ministers mounted on the wall. I'm acutely aware of that the number of aged care ministers with promising careers have been hoisted on the petard of aged care reform. No one understands that in this room more than I do. But I also, firstly, have a deep passion for the sector. I worked in it very, very closely for 15 years before I came into this place. I've seen very much up front the reasons for aged care reform. It's not an academic exercise for me, it's something I understand quite viscerally. And I think also that the government broadly, and I think for that matter the Parliament, understands that the sector and the community are at a place that they've not been before, at least for 20, 25 years. There is a level of maturity in their approach to this that wasn't there 12, 13 years ago when we last tried this thing. And if those planets stay in one line, I think our chance to get through what is always a politically difficult piece of reform, aged care, is much higher. Now, does that mean the thing might not go off the rails? No. I've said to the sector, I mean, the two big risks are that the government will be distracted by something more pressing, and, you know, the last few months have shown how easily that can happen. A great risk, I think, to put things back to the sector is that the sector splits. And what I think's been great about the last few years has been that providers and unions and consumer groups have been able to come together largely under the rubric of NACA, the National Aged Care Alliance, and thrash out some of these difficult issues in a room and find points of consensus which I'm glad to say, vastly outnumber the points of difference. That is very different to where we were in the late 90s, where the sector providers split, consumers were over here, some providers were there, other providers there, the unions and the Labor Party in another place altogether. So I think this is a different environment for a reform discussion, but these things will be very difficult, and we need to, I guess, retain a mature, sort of orderly approach to how we talk about the results of the PC report. Last thing I'll say is that, I've said we're not simply going to rubber stamp the Productivity Commission report. I don't think anyone would expect us to. This is a group of very smart people who have a long background in aged care, and I think they put together a really clever piece of work in the draft report, and think that will even be improved in the final report. But having said that, it's our job to go and talk to the community about what's doable, to consider the funding implications in the broader context of other budgetary pressures, and to think about what we can get through this place, which is a rather difficult beast under the new paradigm. We can't just assume we're going to get things through the Parliament.
Tina Smith with the Mental Health Coordinating Council, and what I want to touch on is possibly a funding issue, but I don't think it really is that. I think what it is an opportunity for improved care coordination practice that's being missed, and care coordination and integrated care, I know, is of great concern to you, and also a theme across our day today. We're all sort of sitting around waiting for the mid-year COAG comeback on mental health to see where mental health's going to fit in healthcare reform, but there's in fact some stuff that's happening now that's of great concern with the flexible care packages that are being rolled out. I won't go into a detailed description of what they are. I know you know what they are. But my concern is this: with that money going to GP divisions, Medicare locals, the clinical and non-clinical funding and not being quarantined, we're seeing that money evaporate, intentions for that to evaporate into clinical services. We're seeing the same old siloing issues of government, non-government, clinical, non-clinical of the past. The end.
Firstly, to deal with that clinical, non-clinical thing, look, this is a battle that's been waging since the 1970s, the health community services battle. I don't know whether it rages in your council, but I recognise it, and I recognise the difficulty of it. There is a bit of a view going around that the $60 million that was committed in the election for non-clinical services is somehow not quarantined. Well, that's just not right. That will go to non-clinical services. We exampled in the policy FAMS and day-to-day type services. But the broader challenge of coordination, I think, is a really significant one. The 2006 COAG agreement on mental health was a landmark agreement. I mean, Howard and Yema drove it, and they did really well. It led to very significant, largely unilateral investment by the Commonwealth in things like Headspace and FAMS and such like, and by states as well. But the so-called flagship initiative of the agreement was to create a system of coordinated care between all those services, and it went nowhere. And it largely went nowhere because there was no money behind it. At the end of the day, my view of coordinated care, and you guys know this stuff better than I do, but my view about it is you can't just tack it onto someone else's job. Someone has to get up in the morning thinking, my job today is to coordinate care. It's not, my job today is to look after someone's housing, and if I find some time while I'm eating my sandwich at lunch, I'll give a doctor a ring, or I'll give an employment services provider a ring. And this is, I think, what we've got to grapple with. I mean, at the end of the day, it is resources that has to go into coordination and integration per se, not just allocate the last person to walk in the room with that responsibility additionally to whatever else they're paid to do. Thank you for having me.
Well done.